Hey everybody, Luke Gordon, physical therapist here, and in this video we are talking about stiff knee syndrome in people following total knee replacement surgery. So for about 1 out of 10, 1 out of 20 people following knee replacement surgery, they're going to develop some level of ongoing pain, stiffness, soreness, swelling in the knee, and if it's bad enough, we call it stiff knee syndrome. So in this video we're going to focus on two different topics. The first one is, what is stiff knee syndrome? What does it look like? How do you know if you're moving towards stiff knee syndrome so that you can kind of keep an eye out for it? So that's the first thing we'll talk about. And the second thing in this video that we're going to talk about is the 3 things that you should really focus on after surgery to avoid stiff knee syndrome. So it should be a good video for you if you're considering total knee surgery or you just had total knee surgery. And then towards the end, we'll actually talk about if you have some ongoing issues with stiff knee, what you can do with it, even if you're 6 months to a year out. So first, let's just talk about what stiff knee syndrome is, what it looks like. So for most people, stiff knee syndrome just looks like they're going through their rehab after surgery, and for whatever reason, their knee just isn't loosening up. For a lot of them, it's not fully extending, so it's not straightening. Maybe you just, as you walk, you can't get your knee straight, so it's throwing off the way you walk. Then on the other side of that is it's not bending very far as well. So that kind of also throws off the way you walk. So there's this limited range of motion, obviously, is the obvious one. Your knee does feel stiff. That's why we call it stiff knee syndrome. But there's also typically ongoing pain, more stiffness than you would expect, like if you go sitting up from a chair or just waking up first thing in the morning. There can also be swelling and heat surrounding the knee. And for a lot of people, they have weakness in their quads as well. So it kind of all rolls into this big issue we call stiff knee syndrome. At the end of the day, what it means though is that your knee doesn't feel the way you think it should feel, and it's more stiff than it should be, and it's really throwing off the way that you walk and the way that you get around, and it's not allowing you to do the activities you want to do. So that's stiff knee syndrome in a nutshell. Again, probably somewhere between 5 to 10% of people after total knee are going to have it. And so let's switch our focus then to saying, okay, obviously you don't want to be one of those 5 to 10% of people. So what are the 3 things that you can do to really limit your potential for having stiff knee syndrome? So the first one that you want to focus on after surgery to avoid stiff knee syndrome is just stay active. Be as active as you can after surgery. So get up every half hour and just walk around. Maybe go for a short walk outside if it's nice out, walk around your house, go to the kitchen, go to the bathroom, and just do your stretches as you're going. Now that first tip might sound really oversimplified, but really it's really important, because a lot of people, you had a major surgery, you don't feel great, you're in a lot of pain, a lot of swelling, and you just want to relax, elevate your leg, which is all good stuff, but you do want to make sure that you have regular, small amounts of activity throughout the day. That being said, you don't want to be overactive, because that can make your knee pain feel worse and it can make your swelling worse. But you just want, again, short bursts of activity throughout the day. Go for short walks, do a few of your stretches, get the blood flowing, do everything that you can to just keep the knee mobile. So that's the first tip, stay active. The second tip is use some type of a compression garment on your knee. It could just go up to your knee. I prefer the ones that go up past your knees, up towards your thighs. The compression garment is going to really help you just maintain a lower level of swelling, and it's going to keep your blood from pooling. So that's going to help, because really one of the things that's really limiting your ability to bend and straighten your knee right after surgery is that swelling. So a compression garment is definitely a good thing to do. Not all doctors and nurses are going to prescribe those for you, so you might have to talk to your therapist if you're doing PT, or just go to the local Walgreens or whatever the medical supply store is in your area and get some compression stockings or compression garments for your legs. So that's tip number 2. And the third one is prehab. So prehab, if you've already had surgery, it's a little bit late for prehab, because prehab means that you're doing rehab before surgery. But you are much, much, much less likely to have a stiff knee, or just a knee that plateaus in general and takes longer to recover after surgery, if you've done some level of prehab before surgery. Now, I've got a lot of videos on, top 4 exercises before surgery, which I can link up here or at the end of the video. I'll try to pop it up right here though. So those are great ones to do. I've got videos on exercises you're going to do after surgery, but really, as much as you can do before surgery, you're going to have significantly lower likelihood of having stiff knee syndrome after. So before surgery, when we talk about prehab, you're talking about working on your strength, working on your range of motion, specifically making sure like your quad muscles are really firing and really engaged. You have as much strength there as you can get. And again, statistically speaking, they've done research on this. You are much less likely to have stiff knee syndrome. You're going to have a quicker recovery. You're much less likely to need skilled help, like a skilled nursing facility or rehab facility, nursing home, something like that. So don't, again, if you're watching the video and you're before surgery, that's great. Sorry if you've already had surgery. I guess that third tip doesn't help a whole lot. But really get on the ball before surgery. I know there's a lot going on, but get your knee in as good a shape as you can before surgery. So those are your 3 tips. The second one that I talked about too, I just want to highlight, swelling is such a big deal after surgery. So at the end of this video, I'm going to post some links, or I'll post a link to how to get that swelling down too. So really don't overlook any of these 3 tips. Try to hit all 3 of them if you can, and swelling is a huge one. I've got more videos about how to get full range of motion, and most of that revolves around keeping that swelling down. So those are the 3 tips. One last thing I do want to say before I go today is that if you're 6 months out, 12 months out, 2 years out, and you still have some level of pain, stiffness, swelling, redness, things like that, there are things you can do. I've got more videos on that. I think I'll post those 2 videos at the end of this. I'll do one for swelling and then one for how to deal with long-standing pain. So if you are in that next category of people and you say, man, I'm already this far out, is there any hope for me? Yes, there is. It's just a different approach. So again, I hope that helps you with your total knee recovery. Hopefully you won't get too many complications. It'll be nice and smooth. But if you do, just know that there are things that you can do in your power. So try to do as many things as you can. So I hope that helps. Please like and subscribe before you go. And if you feel like leaving me a positive comment, I always like hearing from people, so please do that as well. Good luck with your total knee surgery and your rehab. Thanks for watching.